backhand and said once a cesarean, always a cesarean.
That's ridiculous.
It is, and it's dangerous. So
I'll
women
work on that.
absolutely have to fight to have a vaginal birth after cesarean. They are safer to do it that way, but they are not as convenient and not as profitable. So
Well,
that is
under
a big
Medicare for
problem.
all, it will work, because
Thank
we
you.
can have those preferences put into Medicare.
And we have to start listening to the women. That's why women are dying, is they just are not being heard. We have to get back to patient-centered healthcare. And that is something that we hear from women all of the time. And then we're also not doing evidence-based care.
Yep.
We are doing physician preference care,
Yep.
and that is a problem.
Choices. And I've been able to shop around, and I just want to say I'm really glad we're discussing these important topics today, because I know so many people in the state don't have that luxury. They live in rural parts of the state, and the decisions they make regarding these issues have a ripple effect on their entire quality of life. And fixing or easing the burden within these areas will truly greatly improve their quality of life here in the state. And so I am certainly an advocate for that. Thank you.
Robin, want to go next?
Hello, everybody. I'm Robin Covington. I'm Vice Chair of the Women's Caucus for the IDP here in the state. I love the topic. I'm so excited to be a part of this topic because I feel like it's been the first time in my almost 38 years on the planet that I've heard people discuss this in depth, the health and well-being of myself and then now my children. I adopted out of the foster care system in Iowa 6 times over, and so I know the difficulties that you face even being considered middle class, if they don't particularly like your religious affiliations, or if they just that way feel like you're not the one. And then I also am still connected with a lot of the children's birth parents, and so I know the struggles they face trying to make their families sustainable, and the things that we could do to make it so that a lot of the children who come into foster care, just like you said, get to go back home. A lot of the services that would be involved in helping an adoptive family could also be involved in helping the birth family
Yes.
when they reunite. And then also as Black women, I'm very interested to talk about our healthcare issues when it comes to pregnancy. I never was pregnant myself, but I had a couple pregnancy scares being a cardiac patient. And I will say, if it were not for my mom, who's a physician herself, I probably would not have had the appropriate advocacy to make sure that I was getting, that people were hearing me when I was making complaints about pain and those things. So I think it's very important that is a discussion that's on the table today. I'm looking forward to it.
My name is Mike Bronick. I'm president of the Iowa State Education Association. And Senator Gillibrand, I would like to say thank you for bringing forth this Bill of Rights, because as a representative of educators, we certainly are deeply concerned about the well-being of children that enter our schools and the families that they come from. And I think it's particularly appropriate now that we're getting to celebrate the 100th year anniversary of the women's right to vote. I think this is a very timely issue going forward. I've done a great deal of traveling across the state, and Senator, some of the things that you talked about are absolutely true. I visited 2 school districts in Northeast Iowa recently where daycare is a major issue in that community, and the school districts were exploring or had explored trying to bring in daycare situations in their buildings, and it was just cost prohibitive. And so if they decide to not continue with that program, then those communities won't have any daycare. And of course, funding is a huge issue for our schools in our state and across the country. And funding for these kind of programs needs to be a fundamental part of it. And I also visited another site in Northeast Iowa that was a residential education facility. And there was a large group of students who were foster students. And they were there because they had nowhere to go. And their level of mental health and trauma occurrences in their history made it difficult for them to learn. And so with no one there besides our public schools to help them, these children were having difficulties learning the principles of living in a democratic society and understanding the basic fundamentals of education. So our teachers were doing everything they could just to help meet the social and emotional needs of the students. And we have to address that before we can even begin to explore academics. And everything that's happening in society is coming into our classrooms. Our educators are faced with every component that we see in the news, that we read in the newspapers. And basic fundamental care before they even enter school is an important thing that we need to emphasize in our country. And of course, universal pre-K. Again, in some of these rural communities, they're working hard to have preschool programming. But with the reduction in resources, it's making it difficult to spread those resources across a pre-K-12 system. And so I want to thank you for bringing this forward, and thank you for caring about our kids and our families.
You're welcome.
Thank you, Senator Gillibrand, for coming. My name is Jen Statler, and I have been in childcare and early childhood education for 25 plus years. I left the field to take care of my firstborn granddaughter, as my daughter is a single mother and needed part-time childcare, which was not available to her. And now, as Ms. Sunday said, family care is not available to people because now we even have not only parents working, but grandparents as well in the workforce. And so childcare availability and affordability is very important to family, even extended family. I volunteer with the Safe Children Action Network. I've been a little less than a year with this organization that I feel so strongly and passionately about, that we are a political voice for kids, and by attending these events and talking to and mobilizing leaders and voters to make policies that hold our leaders accountable to the children and families that they're representing. I especially encouraged hearing that you have proposed these 5 focuses in your Family Bill of Rights, and I would consider that what I have long advocated for in a comprehensive child care program, which starts, as some of my former speakers said here, starts in the womb, starts with the mother and women's health issues. And I also want to say that you mentioned how other industrialized nations have this available to them, and this is true. I had my first daughter, she was born in Germany. I was working for a German firm. I was over there as a military wife, had my first daughter in Germany, and was covered under the German insurance. So I know the benefits of these programs. I was able to stay home with her for the first 6 months and full pay, and then could apply for extended stay. So I'm happy to hear that this is coming this way across the pond. As I said, that we are, especially here with our focus in Iowa, we talked about the child care deserts, and I know this personally, being a child care worker, and knowing how important affordable child care is for the families, also getting quality teachers, quality programs, and paying our workers, which we expect to have a 4-year degree, and we expect them to be well-educated, and however, sometimes that doesn't translate in what they're being paid. And so this is a need.
Necessary.
Yes, yes. And we also talked about access to universal pre-K, and this is a part of that continuing, that comprehensive child care that we're talking about. So to conclude, I just am happy that you're here and willing to, we would like to encourage you to have a clear plan, and you stated very clear plan of, with your Family Bill of Rights, and then, you know, how that is going to look in your platform and the policies that you advocate. Thank you.
Thank you so much. So do we have any questions? We have a conversation. I think one of the things that you mentioned was getting more access for childcare workers, and you have to make sure they get paid at least the minimum wage. And then the minimum wage needs to at least be $15 and indexed to inflation. So that is a necessary part of getting to universal pre-K and affordable daycare. You just need to attract more workers, and you're going to have to pay them more. So as part of my economic platform, specifically on workers' rights, is pay a fair living wage to all workers and make sure child care workers are not exempted. They were literally exempted from minimum wage laws. I mean, as a mother, when you leave your child with an early childhood educator, it's the most important person to your life to have that caregiver be well trained and well paid, because everything is about your child. So it's absurd that we pay such a low amount of money for one of the most important workers in society. It just doesn't make sense, whether you're an early childhood educator or a teacher. Like, it just doesn't make sense. Other thoughts?
I had a question about when you were speaking about adoption, and you were talking about providing a tax credit to ensure families' abilities to adopt and provide a stable home isn't dependent on their wealth. I know when we adopted, we did get a tax credit. It wasn't refundable, so it sits up as a literal
Correct.
credit, and we really could use that money to, like, for example, send the kids to college, because starting out when you've adopted them and they're 8, being able to save up for 6 kids, it's just impossible. We've run the numbers.
Yeah.
And so I was wondering if there is no more credit, or if you have a different plan for the credit that's already in place, or what you mean specifically by that.
It's a more generous tax credit, not a tax deduction, so it applies for lower income families that want to adopt. So instead of a deduction that really only helps middle class families, it's a credit to help all families. And I think it's a bit more generous than the previous credit. So
Okay.
I'll look up the exact number for you so you know what it is.
Thank you.
Other thoughts?
As a child care worker and teacher, and late bloomer, I had my family, I stayed home with my girls, and when they went to school, I went back to school and completed my degree, got a 4-year degree in education, working and going to school part-time. What I would really like you to consider is loan forgiveness for child care, people that are going into early childhood education, and because sometimes it feels like we're taking the vow of poverty going into that. And when they talked about raising the minimum wage to $15 an hour, that's more than I was getting paid,
Yeah.
and I have a 4-year degree.
It's outrageous. You can't. So one of the ideas I have for education is a national public service. And what I would do is augment what we already do with the GI Bill. Right now, if you serve in our military, when you come back, you can get your education debt-free, paid for by the military. And it was the greatest economic engine after World War II. It was very important to our growth as a country. So I would expand that and open it to healthcare, education, green jobs, and first responders as well. And so under both healthcare and education, you're gonna have this sweet spot where you are telling young people that their education will be debt-free if they go into these absolutely needed professions. We have a nursing shortage. We have a home health care worker shortage. We have an early childhood educator shortage. We have a daycare worker shortage. So it's true. So that's why debt-free college for me is really rooted in this national public service idea to incentivize more young people to go into it. I also have a public service debt forgiveness for people who've already been doing it. If you've done 10 years in a public service role, any of these would qualify. You could then get your college debt expunged, just like vitiated, be taken away. So it would be fully paid for. So those are two ways to get at the high cost of education and the way to get at more young people going into the industries and careers we're desperate for.
So we talked a little bit about the rural hospital system and access to OB-GYNs and that kind of thing. In your plan, do you want to talk a little bit more about how you hope to address the challenges that rural hospitals have? Here in Iowa, we have experienced that, I think, in a way that, is really compounding the problem of healthy families. And, Megan talked about some of the areas that she's there. But yeah, how can we address the rural hospital system, particularly in a state like Iowa, where we have had privatized Medicaid that has absolutely made it much harder for small healthcare providers to provide those services. So yeah, I think it's a really important issue for Iowa.
So it does a couple of things. First, it creates a collaborative improvement and innovation networks, which will focus on infant to maternal mortality and morbidity in rural areas. The purpose of this is to support the rural providers and women as they work to find maternal and obstetric care, identify successful delivery models, develop collaborative networks, provide training and guidance to rural health facilities, and collaborate with regional experts as academic institutions. So basically, it would become a one-stop shop to meet the needs of rural populations, to get the training they need, number one, but also to create the resources to attract more care providers in rural areas. And it would allow for the development of 5 regions, including Indian tribes and frontier areas in the first year of implementation. The second thing it does is really develop telehealth. It helps develop better telehealth networks and telehealth resource centers. It creates a grant program through Human Resources and Service Administration to include maternal and obstetric care providers in a telehealth network. The bill updates the preferences and funding requirements for relevant grants to enable providers focusing on maternal care. So just making it easier to get access to specialist care, to have specialist input, and if you have investments in telehealth, you can do that. Because they don't necessarily have to be located where you are, but you're getting access to their expertise immediately and in a timely way. It also will create a demonstration program that gives grants to training of maternity care providers in rural areas and develops resident programs or fellowships to include rural obstetric tracks for obstetric and family physicians. Finally, the bill will work to improve existing programs to include rural-specific obstetric training for physicians, physician assistants, nurse practitioners, midwives, and doulas. And so it will basically create a funding stream to get more people into these industries in the rural area to meet the need. And where there's funding, hopefully the workforce will flow. Thoughts? Do you want to? Go ahead.
Hi,
And I can ask any of us, you have literally so many activities.
yeah, everybody jump in if you can. My name is Jill Applegates, and I'm with the Caucus for Kids campaign here in Iowa. So many of these issues we really care about, and I'm so happy to hear addressed today. And I'd like to touch back a little bit more on the child care providers and workforce, because you talked about making sure that we are raising the wage for those providers. But what a lot of the struggle with that is that when the wages go up for the providers, then that cost gets put back onto the families. And so I'm curious what your plan is to look at it at both angles. And are you talking about maybe subsidizing more of the wages and then also the assistance for the families?
Yeah.
And to that, when families take child care assistance, and a lot of times it's not reimbursed to the full amount to the providers, and so they lose money on that end as well, and that's just another hit on the centers and their ability to take on more kids and provide quality services.
Let me borrow that again.
Sure, yeah.
So I've been working on at least 3 ways to make childcare more affordable, and it's through subsidies. One is a tax credit, which is allowing people to take an actual tax credit to afford childcare, because childcare, depending on what state you're in, as one statistic we said was $1,000 a month. I mean, $10,000 a year is beyond most people's ability, especially if you're a low-income worker only making $15,000 or $20,000 a year. You can't afford it. So the cost is too high. So you get to the lowering cost through tax credits, but you also get to lowering costs through tax deductions. And so I actually have a bipartisan bill to double the child care tax deduction and to make sure you can deduct up to $6,000 for 2 kids. So $12,000 worth of deductions is very helpful to get you to having 2 kids in daycare. So those are some ways. There's other ways that I've worked on over the years, which is incentivize the businesses to actually provide on-site daycare, giving them tax benefits to either locate it there or to have a plan for their workers and where they have, and actually be invested in making sure their workers have the childcare they need so they can excel in their jobs. And so there's 3 ways to get at affordability so that you can then afford to pay them more.
Thank you.
Hi, I'm Charlie Brewer. I'm a former legislator, and then I ran a Child and Family Policy Center doing research, and now I'm a volunteer for Joe for the Caucus for Kids, and I really appreciate your having a Family Bill of Rights and setting out some important issues around kids and families, and we're really encouraging all candidates to do so, and really think that this should be part of everyone's campaign. So really thank you for doing that. I do want to get into the weeds a little bit with respect to the Family Bill of Rights, and what I think is an opportunity that I hope you will champion, and that is when kids are very young, birth to 3, we know that those are critical times, and the safety, stability, and nurturing in the home environment is absolutely essential, and yet families are often stressed, they may be socially isolated, they may not have access to good information and support, they may be just struggling to hold things together. We also know that that's a period of time when they do see a child health practitioner, and that child health practitioner can play a very positive role through the primary and preventive health services and through referring and a warm handoff to needed supports for doing things that will strengthen the parents' basic capacity to be their child's first teacher, first nurse, first safety officer, and guide to the world. And there are a growing array of exemplary practices there. Right now, those are not covered, by and large, under Medicaid. They're not considered to be covered. Iowa, a number of years ago, established First 5, which really began to do that here. And New York State now, your state, the first 1,000 days in Medicaid is really, I think, the path that we should take to the future in terms of financing the child health practitioner to respond and really be that first point of contact. That's a time when kids are not in care. So I would really urge you to do something to look at the role of Medicaid in really responding to families and being family-centered and responding to social determinants of health.
So we've included that. One of the aspects of the bill is to expand the Children's Health Insurance Program to all children. So we have a big platform of how do we get to healthcare as a right and not a privilege. And for me, it's Medicare for all as a way to get to single payer, letting people buy into Medicare. But as part of that, you cover all kids under CHIP, period. So if you cover all kids under CHIP, all kids up to 26 under CHIP, it's the way you deal with what President Trump's done to unwind access to healthcare, to make it universal.
That speaks to the access question,
Yeah.
which is important, although we now have 96% of all kids covered thanks to CHIP and Medicaid expansions.
Yeah.
It doesn't speak to the content and the practice of care and
Right, so
really
that's
supporting it.
Yes, that's Medicaid's early and periodic screening, diagnostic, and treatment. It's a comprehensive benefit program that is the best health care coverage available for children. So you would make that Medicaid early, which is the same as your 1,000 days. It's making state-of-the-art health care available to all young children.
Well, EPSDT and Bright Futures, which is the AAP and HRSA's
Yeah,
definition of what is high-quality care, are both ways of providing that coverage and care. But that is not the standard of practice. There are exemplary practices like Healthy Steps, centering pregnancy and parenting, the work that doulas do or promotoras
Yes,
do.
for sure.
Those types of practices that really get at supporting the parents with their child and really taking, not just weighing and measuring the kid and vaccinating them, which is after all
No, but actually
important,
healthy living.
but actually promoting and advancing healthy living. There are a legion now of evidence-based programs and practices that do that, but none of them are financed in any way more than what the standard of practice is today.
Right.
And it's not affordable for practitioners to do that, it's not an
Right.
expectation. We need to build up the
Yes,
system.
and make sure that Medicare
Yeah,
covers
so I
it.
think
So if you're gonna
EPSDT
build,
is not being realized in states.
correct,
It needs to be.
and it's just first step anyway. So one of the things that I wanna work on in terms of getting the cost of healthcare down, which is an overarching challenge, if you're gonna have Medicare for all, you're gonna have to fix Medicare first. So one of the ways to get the cost of healthcare down is to make sure that some of this integrative medicine is actually available and reimbursed. So it reimburses doulas, it reimburses home care, it reimburses other integrative aspects of care, from nutrition to exercise to other homeopathies. So you need to, again, stop treating the disease, but actually treat the patient. It's part of a patient-centered care model. And so if you really are going to build on Medicare and make Medicare for all, you're going to need to improve Medicare, improve what it covers, but also improve the reimbursement rates. And for providers who know the system, the reimbursement rate for Medicare doesn't cover everything. So if all of your patients in a network are going to be Medicare patients, you first need to fix Medicare, change your reimbursement rates, but also open up for this integrative medicine and this holistic approach to have patient-centered care that's much more about health and well-being as a way to lower costs. Because so many people, as you said, having a doula, having an in-home birth is so much less expensive. Having natural vaginal birth as opposed to a C-section, so much less expensive. But the reason you're doing it is not because it's less expensive. The reason you're doing it is because it's better quality care. But if you don't allow providers to offer these, they're not going to do it. And once you eliminate the fee-for-service model, then that incentive to do a C-section because you're going to get money goes away.
And I would really urge you to look at the first 1,000 days in
I will, and I'll look at it as a
Medicaid
platform.
and Medicare, because
Yeah.
when you're talking about kids, and particularly young kids, they are not high-cost users of care.
Correct.
If they don't have a known disability, Medicaid is spending about $1,800 a year on them. There aren't going to be savings. We want them to get into more prenatal visits. We want them to have more care coordination. Now, down the road, then they're going to be less likely to have other physical, social, emotional, and
other
cognitive.
Right.
It's a great investment, but it's not going to save money in the short run.
Just long-term,
Yeah.
and that's the whole point. And it's true for early childhood education. We know for every dollar you put into early childhood education, you will get $11 of productivity out of that young person over time because their ability to learn and reach their full potential through our education system is so much more dramatically enhanced.
And that's not the way that healthcare system's
Correct.
operating right now in terms of
And
what
that's
they
why you have
want
to
in
change the
investments.
whole system. You have to change to patient-centered care, because all that preventive care and all that much more holistic approach, it's gonna be healthier people, better health outcomes, less disease, more opportunity. It pays for itself over time, because you're gonna have a more productive child, a productive adult, ultimately.
Senator, while we're on this conversation of healthcare, have you made any plans or developed any thoughts about connecting with public health as we look at prenatal care and early care from birth to 3, birth to 4?
Tell me what you mean about that.
Well,
What's your idea
I
there?
don't know as much as I should, but my sister was a county health nurse, the chair of that for 40 years. And the amount of time that she spent with young mothers and mothers that were expecting, and the kind of counseling, the kind of services that she provided, the immunizations, the pre-programming of how to read to a child before they enter school. Just the connections that public health has with education and the well-being of our children. I just wondered if you had thoughts about that.
Yeah. I do, and I'd have to get some specifics from Iowa, but I know from my own state how well it works. And we talked about it a bit. I went to a healthcare facility in the Bronx, and what they were trying to address childhood obesity. So that's a big problem, because if you have, in New York City, 20% of kids starting pre-K and kindergarten were already obese. That's an issue of knowledge and healthcare and access to healthy foods. And so they realized the best way to deal with childhood obesity was to start meeting with pregnant moms in their health centers. So you could teach the mother about nutrition for herself so that her pregnancy would be more healthy, but then begin to tell her about why breastfeeding is better for your child, if you can do it. If you have the ability to do it, why that helps with not only antibodies and disease prevention, but health and nutrition. And then teaching the mother how to prepare foods for her children and herself. And so getting these parents into early care before they have their child makes all the difference in the world. So it was a public health initiative to deal with childhood obesity. I love the fact that you said that asthma, we now know, is being developed in the child before birth. That's another thing you can do. And one way public health can integrate with public education is using our public schools as clearinghouses for access to public health, making sure there's reliable resources and connection to mental health, to dental health, to nutrition health, to all the things that make our families healthy, making sure schools, particularly in rural areas or low-income areas, can be that convening location.
Community schools.
Yeah, community schools. And so that's, to me, that's a related issue of how you make our public schools stronger and more, but it's exactly right. It's the connection with public health to again, have patient-centered care. Go ahead. You go next. Just go ahead.
Yeah, I think we wanted to give, since we've got such an incredible wealth of knowledge and expertise here sitting around the table, I know I'm excited to be with all of these great colleagues. Give folks another chance to ask some questions, make some additional comments while we've got you all here. So I'd like to open it up to our folks here on the panel. Yes, Representative.
Thank you so much. As I'm sure you figured out in your visits to Iowa, we're pretty pragmatic people here. So what's your plan when we're talking about this? Of course, people are going to be concerned about increased costs, burden on taxpayers, that type of thing. What's your plan to do this in a way that does not become burdensome for taxpayers?
Yep. So a lot of these ideas will pay for themselves. Obviously making parenting more accessible to more families. That's not something that has an additional cost. But the ones that do have cost, the way I have a very clean, easy pay for is through a transaction tax. Right now, we have people buying and selling stocks, bonds, and other countries take a very small amount of money, pennies on the hundreds of dollars. And it can fund all of this and many more ideas, the National Public Service idea, better job training. It's worth $77 billion a year. So if we do a national transaction tax to provide health care as a right, not a privilege, to do this family Bill of Rights, to do national public service, and to actually access full employment through better job training for underemployment, you can pay for those priorities. So that's a very simple way to do it. But a lot of these things we're going to get dividends because, again, you might not have short-term savings, but you're going to have massive long-term savings in healthcare costs overall. And if you do this in combination with your Medicare for All, where people are buying into Medicare, it's something that will be an earned benefit that is yours, that you bought in your whole life, and you could ultimately make it universal. And it creates, two ways to fund a lot of this.
Yeah, do we have any other?
Topic?
Yeah, here, we've got.
Let this gentleman ask a question.
Thank you.
Hi, Senator. It's good to see you again. I'm here actually on behalf of my mom who wasn't able to make it today, and to also offer an invite to everyone on the panel to several rural hospitals in Iowa. I've been asked to offer this to several candidates, and you were one of my first choices to bring in, so I'll talk to your staff about that afterwards. One of the things that we talked about on the panel today was women don't seem to be listened to when they talk about pains and other ailments. My mom has had a very hard time with this, with several ailments. And she's not the only one. I know several women who have the same complaint, that they're ignored, absolutely ignored. My mom went 15 years trying to get a diagnosis. And finally one doctor said, yeah, this is exactly what your problem is. And it was fixed in less than a month. But it took that many years before then that she lived in absolute dire pain. And because of it is now on disability, because it has damaged her body to the point where she can't work. That has huge implications on her ability to have earned income, for Social Security amounts, because we don't have all these changes that the Democratic Party is talking about, so we have to work with what we have now, and these changes need to be addressed, I think, in the process up to wherever your income goals are. So I want to know, what can we do to address that problem? For women who are being ignored, and to deal with the rural healthcare problems with, you might have Medicare, but there's no doctors in your area that take it, and there's not enough providers who can accept everyone who's on it.
So we know through our research on maternal mortality that one of the biggest drivers is institutional racism and institutional sexism. That as your mother was not listened to, many women in America aren't listened to, and their pain, concerns, and how they are feeling is not actually registered by the providers. So one of the ways we want to tackle maternal mortality directly is through better training, actually having state-of-the-art best practices implemented in all hospitals through better training and the resources for better training. I think even the study of these issues is really important. That's why part of our bill for rural America is making the CDC actually do studies on maternal health, on maternal mortality, on female access to healthcare in rural areas. And so once we get more data, we can begin to really zone in on those causes, whether they are institutional racism or sexism, whether they are poor training, whether they are embedded in certain areas. We'll know more. So it's both a research and a training problem, and this bill provides funds for both. Other thoughts?
I think part of the issue and concern for women also not being heard is there's a lack of trust between provider and the patient. We have a lot of turnover in our rural hospitals and our rural clinics, so continuity of care is a big issue. For maternal health care, if you go to a hospital here, you're going to see a group of physicians, not just one. So being able to, number one, have a provider that is a continual provider. You may see many different providers throughout your pregnancy, and then you never know who you're going to get when you go into labor. And even then, your provider can change during birth. So continuity of care is really a big piece of this. Also, electronic medical records. We do have electronic medical records now, but each different facility has their own different system. And so they don't transfer necessarily from one hospital facility to another. Many times they say, well, we can give it to you on a flash drive, or I can, give you a disc to take to your new provider.
And then they won't have the flash drive or the disc player.
Right,
Got it.
right. And then when you ask for a copy of your own records, women are charged for that. So it's absolutely difficult for women to, number one, even know that they need to ask for those. Number two, it's difficult to retrieve those and to be able to present them. Also, many providers, I've heard many stories and have a lot of stories that I could share regarding healthcare in the patient's room, but they're many times just dismissed. When a mom says, I'm in pain after birth, they say, well, of course you are, you just had a baby.
Right.
And there's a lot of what's the word I'm looking for? There's a lot of lack of trust. They aren't believed. Women don't necessarily always know what to describe the pain that they're having. And then they don't always have the information. Part of the work that I do, and just so we're clear, doulas don't just do home births, midwives don't just do home births. We work in any facility, wherever the woman or the person wants to go. We work in a hospital, we work in a birth center, we work at home. We go wherever the pregnant person is going. And the main part of my job is to talk about what the options are. What are the risks? What are the benefits? What are the alternatives? What if we do it and what if we don't? Because we don't have informed consent before we discuss those things. And if you're a patient in a maternity unit, they do not give you informed consent. Sometimes they'll say, well, your baby's looking really big. By ultrasound, we better get an induction started. And that just gets the ball rolling on a big baby. Then you're induced with Pitocin, then it's too hard to handle, and you end up with medication and epidurals. Then the baby's heart tones tank. Then we end up in a cesarean. But without the true risks and benefits of what's happening, women cannot actually make informed consent. So there's a lot of different layers of continuity of care, access to records, how to be able to describe what you're feeling, what you're experiencing, and then just being listened to and believed. That's a huge problem for women. A lot of times I'll hear, well, you got yourself into this. I'm the doctor, I know best. We need to support patients in the kind of care that they're looking for. And sometimes that is why patients come home and do home births with home birth midwives, because they have one provider, they know and develop a relationship with them. My client visits are typically 3 hours long. You won't find a physician, that's willing to do a 3-hour visit with a mom. Postpartum, we go back postpartum for 8 weeks. The amount of money that I'm paid overall, when you figure it out, is less than $8 or $10 an hour for the work we do. And on-call life is not easy. But women are just not listened to, they're not believed, there's no continuity of care, and there are ways to get there, and we know how to do that. We actually do have really great research. Some of the research, some of the best research we also get is from outside of the United States, and for whatever reason, we will not accept research that is not done here, even though we know a better way. So being able to accept that research as truthful data is really important.
Helpful.
And when we have the data, we should be practicing based on that data, and we're not doing that.
I think we've got time for 2 more questions or comments from the panel, yeah.
I wanted to push back a little and get a little bit more in depth in what we're going to do about the institutionalized racism that we know exists that affects African American women when it comes to labor and medicine in general. Like, we know what it is. What is your plan what are you planning to do about it?
So there's 3 good pieces of legislation that folks are supporting right now on institutional racism, particularly for maternal mortality. The one I put together was with all the advocacy groups and providers that find that there's just, unfortunately, racism within the providers. Understanding how they treat women, how they listen to women, not taking pain seriously. And so we have a bill to fund the development of best practices for care, birth and delivery, and postpartum care, but also a set of, they're called what are they called, birth bundles? What do they call, Alex, do you remember? What are the, no, that's the afterwards. There's a term of art, but it's basically a cart It's a medical kit of all the things you need during pregnancy and if emergency arises. So like the right kind of sutures, the right kind of blood on hand if you need to do an infusion. Anything that is needed is done on a cart that can roll into the room, and it's already fully prepped so that no matter what emergency happens, everything that provider needs is right there at a hand's reach. And we instituted this in a place in California that had one of the highest maternal mortality rates, and it cut their maternal mortality rates in half, exponentially lower. And so it was all about training, preparing, and then having the medical equipment on site. And that was the best idea to actually stop women from dying. So it's specific training and it's best practices and giving resources to make hospitals actually implement it.
And they are maternity safety bundles.
Oh, is that what they're called? Maternity safety bundles. So that's what we do, and that's what, of all the providers said, that's the thing that's most important. There's other legislation, I think that other senators have. One, to do the research, just make CDC to research, why do we have so much high maternal death? Why, as if you're a black woman in America, it's 4 times higher? Why in New York City, 12 times higher to die in childbirth or within a year of giving birth in New York City today? Why is that? So there's a piece of legislation that Corey, Kamala, and I support that is the research piece, and then there's one other piece that I thought was also helpful, which I'll look up what it was, but there's 3 ideas right now, and mine is the one for the training, and the bundles have to be on site. So it's the we've been talking to providers and advocates for over a year on what's the best thing I can do to make this stop, and that's what they said. So that's what we're doing.
Thank you. I want to come back to what you had suggested about making corporations or having corporations consider having childcare right on site. And this is a very good idea. I want to add to that for consideration. My middle daughter had 2.5 years ago, she had her first son. She was working for Principal, and they do have an on-site daycare. She got on the list for a slot at their on-site daycare, and when her name came up in about 3-4 months, about the right time, she went to the daycare and she said, well, you know, this is really nice and I want to get him signed up. I just want part-time. And they said, no, we don't have part-time. We have only full-time positions. And she said, well, you do advertise that you have part-time positions. And she said, we don't have part-time. We have it advertised, yes, but we fill those with full-time, you know, and because, and I think, you know, it's partly financial. And so I think that we need to, when we're talking to corporations that have the on-site daycares, that we need to say, have those part-time positions. Now, my daughter did not put him in the daycare. I stepped up and took care of my grandson gladly. The one thing is that she went back to work, first part-time, then full-time, and it was too much. And she ended up having to take disability for postpartum because it was too much too fast. However, had that part-time been available to her, I think that it would have been a nicer transition for not only herself, but the baby, the family. And so that is something that we need to consider. And one other thing, I think that the corporations and companies can also be advocates for these learning and, the first 5, these programs of training and educating involve the parents with these teaching and education.
Yeah, that's very good. Yeah, and I've been exposed to this issue a little bit for our military families, because when you were a military family, so you know what happens. When our men and women who serve our military get deployed, one of the bills I just passed this past year with the Republican House, Senate, and President signing into law was making sure the daycare centers on military bases were open for the hours that our service members have to work. So they needed it to be able to open early in the morning and late at night, because if your orders are to work from 6 a.m. to 10 p.m., you have to meet your orders. You don't get to choose. And so we changed the law on a bipartisan basis to actually mandate the daycare centers reflect the needs of the service members. And we need to do that in all daycare centers. And if we can begin to subsidize the cost of daycare, you'll be able to have more part-time workers, more hours, and just more slots. You don't even have enough number of daycare providers in most states. There's typically a huge shortage. And then, to the extent people want to offer daycare in their homes, we need to start talking about how we compensate care as a way to make sure people who are working inside the home, caring for a loved one, can actually have compensation, and that's something I'm working on right now. So I think your experience is so similar to so many parents that they don't have access to affordable quality daycare that meets their needs, so they have to go to informal care, a mother, a grandmother, an aunt, somebody down the street. And then if your informal caregiver is sick, well, then you're going to miss work. And if you miss work, you might get fired. If you get fired, you won't have income. It's just this very vicious cycle that harms people. So affordable daycare is just necessary for families. I had another bipartisan idea on affordable daycare to make it to actually classify as a business expense. So it's going to get better tax treatment as a result. So just making it more affordable for more people, and then incentivizing the companies to actually create the care opportunities. And I just know this as a mom. I remember when I was a young member of Congress, the fact that they have subsidized daycare for members of Congress, it's still very expensive. It was $10,000 a year. It wasn't inexpensive, but having it a half mile away, I could go for the first 9 months of Henry's life. I could go nurse during the day because I had flexibility in my job. How many moms get to duck out of work for an hour to go nurse their child in the middle of the day for their lunch hour? Like zero. It's so unavailable. So you want to have more opportunity for having your daycare arrangement be very close to where you work so you can meet your needs as a worker, but instead of taking a coffee break, just going to see your child and play with your child for 5 minutes. Like, how amazing would that be for your child and for you? It'd be like the best morale builder the company could have. So that's why I've been working on it. But I just want to thank you all for coming. This is something that's really personally important to me as one of the only mothers of young children in the U.S. Senate. As somebody who's been, was only the 6th member of Congress ever to have a baby while serving in Congress. There's an absence of women's voices to talk about the importance of families and the needs and the economic issues that affect us so deeply. It's why I've worked my whole life on trying to elect more women and trying to elevate the voices of women so that our concerns can be heard and that we can be well and better represented by those who purport to serve us. So thank you so much for coming. I want to thank these amazing advocates and leaders who have been at the front lines, and I want to thank all the audience who participated today for participating. Thank you.
Thoughts now that it's law in Missouri and there's been an appeal to Alabama?
I think these efforts by now 30 states across this country to undermine women's reproductive rights is an all-out assault by the Republican Party on women, on our equality, on our reproductive freedom, on our basic civil rights and basic human rights. And this is part of President Trump's plan to overturn Roe v. Wade. He has a full intention, as he told us as a candidate, as he's told us as a president, to criminalize women's reproductive decisions and to criminalize access by doctors.
Do you think this changes the calculation the voters make in choosing a candidate for the Democratic Party?
I do. I think it's absolutely relevant to so many people in this country.
70% of Americans overall support Roe v. Wade as law of the land, believe that access to reproductive care is a human right, and that's true across the whole country. And the truth is, 1 in 4 women will access abortion services at some point in their lifetimes. And so women and men who love them know that access is just basic human rights and basic health care. So I think women across this country will continue to march against President Trump. They will continue to vote against President Trump, just as we saw in 2018.
So you've been struggling to break out of sort of the low single digits, you and a number of candidates. Do you see, though, this round of laws that we've seen attacking, as in your words, going after abortion rights, as an opportunity for you to break out? Do you see this as a chance for you to break out from the pack?
Well, I've been working hard across the country to talk to voters directly about what they care about, and I think we are building support every week, every month, more and more support. And as you know, it's really early, and this is definitely a marathon and not a sprint. So I'm really confident that I will get the support I need to not only be part of the debate stage, but also to be the nominee. And so I'm going to just keep working. This is something I've always cared about. It's not something new. It's something I've been fighting for the 12 years I've been in public service. And it's something that I've made central to who I am. I lead the debate not just on reproductive freedom, but on whether we value women, whether we have national paid leave, whether we have affordable daycare, whether we have universal pre-K, whether we have equal pay for equal work, whether we have a national paid leave plan. I also lead the movements on stopping gender-based violence, sexual assault in the military, on college campuses, even harassment in Congress. So this is fundamental to who I am, and I will use my voice on every platform I have to fight back against it.
You said last week that the Democratic Party should be 100% pro-choice, 100% in support of abortion rights. Does that mean that the different sort of Democratic Party committees, the DCCC, the DNC, the DSCC, should they support pro-life candidates who are Democrats who are running for office?
I just know what I'm going to do. I'm going to support pro-choice Democratic candidates, and I will get involved in primaries. I've been fighting hard to get more women to run for office so that our voices can be lifted up. I want to get 51% of women in Congress someday. It's why, through Off the Sidelines, I've raised over $7 million for women candidates, more than $1 million for women of color, because we need to change who has a seat at the table if we want to change the outcome. And so I'm going to focus on pro-choice women candidates across this country, keep helping them run, keep asking them to run, and lifting up their voices.
Are there any other primaries that you're interested in getting involved in?
Well, so far I've gotten involved in Marie
Marie.
Newman's race, but I will get involved in others as candidates begin to emerge to run in places where members of Congress are not pro-choice and don't support the values that I support.
And then last week, former Vice President Joe Biden said that he thought once Trump left office, Republicans would have an epiphany, was the quote, and said that they would start working with Democrats again. Is that something that you think Democrats can count on, that if you or one of the other candidates becomes president, that Republicans will be willing to work with you?
So I think his diagnosis of the issue of today is not exactly right. I work on a bipartisan basis every day. In fact, in the last Congress, I passed 18 bills, some that we actually talked about today. And so members of Congress can be bipartisan regardless of who they are. And I have a very strong bipartisan record, repealing Don't Ask, Don't Tell, passing the 9/11 health bill twice, passing ethics regulation and laws to ban insider trading by members of Congress. So I already do it. And so there's many leaders in Congress who are already deeply bipartisan, who get things done, which is one of the reasons why I'm running for president. Because I think more than anything, this country needs to heal. We need to bring each other back together again. And we need a leader who's brave enough to take on the special interests, to take on the greed and corruption in Washington, to take on their own party if necessary, to do what's right. And that's who I am. That's my history. That's what I've done. And so I know I can bring this country back together again. I can win the red places, the blue places, and the purple places. And I know I can lead bipartisan legislation so we can actually help people again. Because it's what I've done every 12 years I've been in Congress.
Yeah, Senator, a big problem with our elections nowadays is money.
Yes.
And money's tied to
everything.
Corporate giving.
Yes.
And corporate giving is tied to corporate personhood.
Yep.
And I wonder if, one, you're prepared to make an effort to remove corporate personhood from our
yes.
Reality. But if you might go further, there was a time in the Republic when corporations did not have perpetual charters, but that they had to reapply. after a certain time.
Interesting.
And I wonder if maybe you would be willing to entertain that notion.
Yes, I don't know much about perpetual charters, so I will look into that because that's interesting. But I do not believe, number one, that money is speech. I also do not believe that corporations have free speech rights. I do not believe in personhood for corporations. So my goal will be to unwind Citizens United, to actually restate the law of the land, that money is not speech. I'm running on publicly funded elections. I think you've got to get the greed and corruption out of Congress, and the best way to do that is get money out of politics. The best way to do that is publicly funded elections. And so I am the first presidential candidate to have a platform on getting money out of politics. Our publicly funded election bill is the most innovative way to begin to change who has power and who has a seat at the table. But if you don't go to the root of corruption, which is money and greed, you're never going to get the power restored to the hands of the people. It's why I'm not taking corporate PAC checks. It's why I'm not taking federal lobbyist money. It's why I'm not having an individual super PAC, because I really believe you got to get money out of politics to begin to do any of the things we talked about. If I want to get this Family Bill of Rights passed, I need to get money out of politics. If I want health care as a right, not a privilege, I got to have publicly funded elections. And so you've got to take away this power that's derived from unlimited wealth. The fact that big companies can spend millions of dollars on lobbyists, the fact they can spend tens and hundreds of millions of dollars on advertising. I would pass the reform for disclosing who's spending the money and how. So I would unwind the protections that this Supreme Court has put in place for money in politics.
Senator, beyond, or back to the abortion issue, beyond just these bans, there's ways that states can do other maneuvers to reduce the amount of abortion providers, whether it's stripping them of funding. I think Aaron Davis and Rippey mentioned how Iowa took a measure to get Planned Parenthood out of its family planning network. What's your answer to those other maneuvers that state lawmakers, no matter what happens at the federal level, could do?
This is an all-out assault on women. It's a war on women, and it's trying to take away our equality and our human rights. So they do things like require any provider to have admitting privileges at a hospital, knowing that that will take away lots of health centers across the state or the country that now can't provide abortion services. They're very specific about their intentions. Now you have very bold legislatures like Alabama that's just criminalizing all abortion and creating criminal penalties of up to 99 years for doctors that offer abortion services. So now they've really taken off the how do you say it? They're now saying what they've always meant, that they want to fully criminalize abortion and they want to make it illegal, as opposed to making it difficult to get access. So they've ripped off the Band-Aid, that's what they're doing, and they're intending to overturn Roe v. Wade. They are intending that these laws will be taken to the Supreme Court, and they're intending that Justice Kavanaugh and Gorsuch will deliver the overturning of Roe v. Wade, which, by the way, they both lied about in their hearings.
Senator, a few years back, Democrats really loved it when Thomas Frank wrote What's the Matter with Kansas. They didn't like it so much when he wrote Listen Liberal about, the first was, of course, about the people voting against their own interests and how the Republicans managed to seduce people to do that. The second was more about the Democrats having abandoned working people and gone to Wall Street. So what's your notion of that dynamic?
Well, I don't think that diagnosis is wrong. It's one of the corruptions of money in politics. I think you have to take on the special interests. You have to take on the greed and corruption of companies to actually solve the problems that families are facing. And in terms of workers' rights, you need to start rewarding work in this country again. And to me, that means a bunch of things. It means allowing workers to unionize, giving them the ability to collectively bargain, and getting rid of the right to work laws and allowing workers to have card checks so they can unionize easier. 2, living minimum wage indexed to inflation, at least start at $15, get rid of tipped wage, pay all workers at least the minimum wage. We talked about home health aides today and early childhood education workers. 3, Make sure that anyone underemployed, because underemployment is a huge issue in Iowa. You have low unemployment, but your underemployment's very high. Commit as a country to better job training. So someone who is underemployed can go to a community college or a state school, an apprenticeship program, or a not-for-profit, and actually have that training be funded to get them a higher paying job in the field where they're really interested. And then last, really push companies to lead better, asking them to consider being public good companies, asking them to have a social mission, a mission for social good, and give them a lower tax rate if they do it. So something in between for-profit and not-for-profit, something akin to B Corps, but actually matching it with a lower tax rate. And then last, really incentivizing employee ownership and co-ops. If you want to increase people's pay, if you want to give them more resources and more control over their working life, incentivize employee ownership. We just passed a bill last year, again in Republican House and Republican Senate and Republican president signing it, was this bill to tell baby boomers, which is a huge issue for Iowa. You have a lot of small businesses because you have had a commitment to small businesses and employee ownership in Iowa for a long time. When they age out, when these baby boomers retire, all those jobs will be lost. All those workers that work there might not have a job. So I passed legislation to make it easier to sell your business to your employees.
Can you give us an update on where you are with the 65,000 donor threshold?
Getting closer every week. KirstenGillibrand.com. If you like what you heard, please send $1. We will make it. We will guarantee our spot on that debate stage. Very optimistic. We've had really good response over the last few weeks now that we've been telling people that we do need their help. They can't assume that we're going to be there unless this is guaranteed. And they're responding great, so I hope Iowa responds too.
Do you think that these abortion laws, attacks on abortion rights, has increased potentially, interest and support via fundraising?
I don't know, but I do know that I'm a voice for all women in this country, and that my leadership on these issues matters. And so maybe more supporters will notice that, and that I've been working on it for the last decade.
Great. Thank you, Senator.
One more? Yeah, Senator, so today, you talked really in depth about policy, about women's health care and childcare. Can you talk a little bit about why personally this is important to you and your own story?
Yeah. So I was the 6th woman ever to give birth as a member of Congress. That in and of itself is shocking. But it shows that people who are in these decision-making roles, they tend to be male, they tend to be white, and they tend to be affluent. And so they don't understand necessarily that access to affordable daycare is make or break for any family. They don't know the challenges of giving birth and the expense and the difficulties and what moms and parents go through in that first month, 2 months of life. They don't necessarily know how important early childhood education is because they never took their kid to daycare. They don't even know how much daycare costs. Maybe their spouses did all the work. We don't know their stories. I just know they haven't lifted up these issues ever. I was the first national leader to talk about having a national paid leave plan. I elevated the issue 5 years ago with some colleagues of mine, and we have made this an issue that everyone is for. They might not be for the same formulation, but 70% of America wants paid leave. So this is a job for me because I have lived it. I am one of the only mothers of young children in Congress, particularly in the Senate. There's only a couple of us. And so I think my voice really matters. And so I'm excited to be running for president so I can lift up these issues on the national stage.
Great, thanks guys.
Thanks, Senator.
Thanks for coming out, guys.
Thank you.
Thank you.